In our work environment, working the child development program, we work in multidisciplinary teams. And so a lot of our work is both multidisciplinary in that you are doing things with other disciplines, but there's also a large component of our work that we would say was transdisciplinary, that there's a core set of generic skills that you need when you're working with children and families, and that's around some counselling skills, how you communicate with people, how you give general information and advice around child development disabilities and all of those sorts of things. And so that whole set of skills comes through experience, and it comes often through working with other professionals and hearing them talk to families and learning from that and starting to implement some of that in your own practice. And so because we have such a great environment in terms of having a whole set of different disciplines in the one place, what we've done over the years is plan at the beginning of the year when different disciplines will take students. So we'll sit down and look at when the OT placements are offered and speech placements and physio, and actively try and take students at the same time, so that when students are here on placement, they have opportunity to learn from their peers, as well as opportunity within the placement to observe other disciplines and learn about multidisciplinary and transdisciplinary practice. So how we set up placements intentionally to sometimes sort of, I guess, create a little student team. So when we are working with a child and family that there are multiple disciplines involved in, the students can get involved in that as well. And so then they can have their own discussions. They've all seen the same child from their discipline perspective, and gives them opportunity to try and pull that information together and learn from each other about other disciplines' roles, but also how we overlap and how there's a lot of things that we all do that are similar when we're working with children and families. What we don't do is probably the interprofessional supervision part of it. Each of the students who come have a discipline-specific supervisor. In an ad hoc way, we would, if two students came and watched you in a clinical setting, you would sit down and talk to those students and debrief and discuss their observations afterwards. So we do a lot of that, where they're getting that experience during their placement of having opportunity to discuss with different disciplines what they've seen and what they've observed, or why people do things in a particular way. That happens with our doctors as well, so that's probably something that we have that's unique. They have opportunity to observe our paediatricians talking to families and then ask them questions as well. So there's a lot of really rich learning experiences, I think, in being able to do that. And so then the other part of that then they're able to do is, the more exposure you have to the other disciplines, including our doctors and our team, I guess the more comfort when it comes to case conferences and team meetings, in being able to feel comfortable to assume, so for me, for the student to assume the role of the OT in that setting and present information and discuss a child. So you set up the relationships, and you also start to see where you fit in the picture. And so if you're more comfortable with where you fit and what's the value of your information or what you bring or your perspective about a child and a family, then I think you're more confident in being able to present that information.